Hello, this is Matthew Camp with Echelon Surgical Specialists. Today we're going to talk about massive weight loss and the resulting excess of skin that many patients have after achieving their desired weight. It can be very distressing to have weighed 300 pounds and now weigh 150, but have all these excess areas of skin that make you feel as if you were still overweight. It's very emotionally taxing, and plastic surgeons address this dilemma all the time. So people will have lost the weight, they feel like they should fit in their clothes, and they don't, because they've got to tuck their skin in strategically in their new slender clothes, and they feel awkward. And so the areas that we address are excess skin of the thighs, excess skin of the trunk, and excess skin of the breasts and arms. So many people have a flab of skin that hangs over the pubis, and it goes all the way around and onto the buttocks area, and the buttocks sag. So there are multiple surgeries we do to address this. One is the body lift. Body lift basically addresses the core lower area below the rib cage. So the excess skin of the tummy is addressed, it's removed and tucked, and the area on the back, the buttocks are lifted and they're augmented with your own tissue, which is to say we tuck some of the excess skin down underneath the skin that's being lifted and removed. So this gives you a nice full appearance of your buttocks, and also addresses the saddlebags on the thighs. So that's one surgery that I would do at one time. That's all the surgery you want in that day. Other surgeries would be lifting and augmenting the breasts. This can be combined with removal of excess skin on the arms. These can be done in one visit to the operating room as well. And then the medial thigh lift is something that I would suggest that you do on a separate visit. So there'll be 3 separate surgeries. Each of one has a fairly significant recovery period, 4 to 6 weeks, and I wouldn't want to do surgeries any sooner than that. So after you have your first surgery, give yourself some time. It takes a lot of energy to recover from surgery. It takes a lot of metabolic energy and protein in order to stitch everything back together. A lot of people have questions about, is this going to hurt? Well, surgery is not a painless thing. So yeah, you may have discomfort, but the level of discomfort is something that we can manage. So one thing that I do that some other folks don't is I infuse a long-acting numbing medication that lasts for 3 days in the area that you've been operated. So you can wake up and not be in serious pain. You'll feel sore, and after several days you may notice that, yeah, I actually did have a major surgery, but the immediate post-operative pain is much improved with the use of a medication called Exparel. After you've had a tummy tuck and lift on your back, you're going to feel stiff in your core section. You're not going to want to be doing any kind of core exercises for 4 to 6 weeks. You can still do other exercises such as going for a walk, doing upper body exercises, but you really kind of want to lay off on the stuff around your midsection just to give yourself a chance to heal. With regards to the breast surgery and the upper arm surgery, the same rule applies. You're not going to be wanting to do any kind of upper body workouts for 4 to 6 weeks. With a medial thigh lift, walking is something you might want to back off on. But thankfully, there are many other exercises you can do to stay fit and keep your blood flowing. It's very important after surgery to get up and be about. You don't want to be laying in bed feeling sorry for yourself, and that's the reason I use the Exparel. People don't hurt that much. They can get up and go to the bathroom. All these surgeries, there's things you can do immediately when you go home. Okay, so you can get up and walk to the bathroom. Just do your activities of daily life in your house, light exercise, etc. All these surgeries, you go home the same day. There's no stay overnight in the hospital, thanks to the use of Exparel. Your pain is manageable from the get-go. As soon as you wake up, We make sure you're breathing okay and your oxygenation is all right and you're comfortable, and then you get to go home and sleep in your own bed. All these surgeries are time tested, very successful. I have some of the happiest patients have had body lifts and have had upper body work, such as mastopexy augmentation, which is breast lifting and tucking that area. Also, removal of the excess arm skin and thigh lifts. So, if you have these problems, look me up. My name is Matthew Camp, EchelonSurgicalSpecialist.com. Good talking to you.